nearly 20 seniors will have been diagnosed with dementia. That's one every 66 seconds. But here's the shocking part. What if the cause isn't just aging, but the medications sitting in your medicine cabinet right now? You've been told these pills are safe, routine, even essential. But research shows something terrifying. At least one drug that most seniors take daily can shrink memory centers in the brain by nearly 30% in less than a year. And the pharmaceutical industry has known this for decades. Yet they make billions selling the same pills that may be quietly destroying memory, independence, and quality of life. In this senior guide video, we'll uncover the 9 most dangerous medications for memory and brain health, ranked from commonly overlooked to the most mind-destroying. And trust me, you don't want to miss number 3. It's prescribed to millions for something harmless. But studies show it can directly damage memory regions of your brain, and most people have no clue. Before we dive in, tell us in the comments, what medications are you currently taking every day? Have you noticed sudden brain fog or forgetfulness since starting them? We read every comment and often reply with personalized insights. Don't stay silent, this could save your mind. Now, let's begin with number 9. Number 9, diphenhydramine, Benadryl. Diphenhydramine, better known as Benadryl, is one of the most common over-the-counter pills. Millions of seniors use it to fall asleep at night, relieve allergies, or ease cold symptoms. It seems harmless, right? But here's the hidden truth. Benadryl belongs to a class of drugs called anticholinergics. These drugs block a brain chemical called acetylcholine, which is essential for forming new memories and staying alert. The older your brain gets, the more it relies on every bit of acetylcholine it has left. And when diphenhydramine interferes with this process, the results can be devastating. Difficulty storing new memories, mental fog, and confusion that looks like normal aging. In fact, a 2023 study found that seniors who regularly used anticholinergic drugs had a 54% higher risk of developing dementia compared to those who didn't. How to protect yourself? Avoid products labeled PM, nighttime, or even allergy relief. These often contain hidden diphenhydramine. For allergies, safer options include loratadine, Claritin, which does not cross into the brain and is much safer for long-term use. And remember, never stop a medication suddenly, always talk to your doctor first. Number 8, proton pump inhibitors, PPIs, Prilosec, Nexium. Next on the list are proton pump inhibitors, or PPIs, like Prilosec, omeprazole, and Nexium, esomeprazole. These drugs are designed to reduce stomach acid. They're often prescribed for heartburn, GERD, and acid reflux. Many seniors stay on them for years, even decades, because symptoms often return the moment they stop. But here's what's rarely discussed. PPIs interfere with the absorption of vitamin B12, magnesium, and calcium, nutrients your brain absolutely needs to stay sharp. Without them, your neurons misfire and memory begins to falter. A 2016 study in JAMA Neurology found that seniors aged 75 and older who regularly used PPIs had a 44% increased risk of dementia compared to non-users. Even worse, PPIs have been shown to increase amyloid beta plaques in the brain, toxic proteins strongly linked to Alzheimer's disease. What can you do instead? Talk to your doctor about tapering off PPIs slowly. Consider safer alternatives like H2 blockers, famotidine, brand name Pepcid, which are less likely to harm memory. Some natural remedies, like chewing deglycyrrhizinated licorice, DGL, can soothe the stomach lining without interfering with brain health. Number 7. Bladder control medications, oxybutynin, ditropan. Number 7 is oxybutynin, commonly sold as ditropan. It's prescribed to millions of seniors struggling with bladder control or urinary incontinence. On the surface, it seems like a simple solution, but under the hood, it works by blocking acetylcholine, the same vital brain chemical disrupted by Benadryl. And unlike weaker drugs, oxybutynin crosses into the brain more easily, directly interfering with the hippocampus, the brain's memory hub. In a 2019 study published in the BMJ, seniors over 65 who took strong bladder medications like oxybutynin for more than a year had a 49% higher risk of dementia. The worst part? Most seniors are never warned. They think memory lapses are just part of getting old, when in reality, their medication may be the hidden cause. What to do instead? Ask your doctor about newer alternatives like mirabegron, Myabetriq. Unlike oxybutynin, it does not block acetylcholine and has shown far less impact on memory. Number 6. Statins, Zocor, Lipitor. Statins are some of the most widely prescribed drugs in the world. If you're over 60, chances are you or someone you know has been prescribed one. The most common names are simvastatin, Zocor, and atorvastatin, Lipitor. Doctors prescribe them to lower cholesterol and reduce the risk of heart attacks and strokes. And yes, they do lower cholesterol effectively. But here's the problem. Your brain actually needs cholesterol. Did you know the human brain is nearly 60% fat? Cholesterol is critical for building and maintaining the myelin sheath, the protective coating around your brain cells that helps nerve signals travel smoothly. Without it, signals slow down, memory weakens, and thinking becomes cloudy. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 who had been on statins for more than 3 years had a 26% higher risk of mild cognitive impairment, and those on higher doses reported even more severe problems. Patients often describe moments of sudden confusion, forgetting names of close friends, or even losing track of familiar driving routes. Not all statins are equal. Some, like pravastatin and rosuvastatin, don't cross into the brain as easily and are considered safer. But the more common ones, like Zocor and Lipitor, do affect the brain more directly. What can you do? If you've been on a statin for years and are noticing new brain fog or forgetfulness, don't ignore it. Talk to your doctor about dose adjustments or whether a switch to a different statin is possible. Lifestyle changes, like increasing fiber and omega-3 fats, can also support cholesterol naturally without the same cognitive risks. Before we continue the countdown, if you find this information eye-opening, take a moment to subscribe to Senior Guide. We create videos just like this, filled with practical tips to help seniors live healthier, sharper, and longer lives. Don't miss the upcoming parts of this countdown. Hit the subscribe button now and join our community. Number 5. Benzodiazepines, Xanax, Valium, Ativan. Next up are the benzodiazepines, drugs like alprazolam, Xanax, diazepam, Valium, and lorazepam, Ativan. These are some of the most commonly prescribed medications for anxiety and sleep problems. At first, they can feel like lifesavers. They calm racing thoughts, ease panic, and help you sleep. But here's the hidden danger. They work by sedating the brain, slowing down neural activity. Over time, this leads to a kind of chemical fog. A 2022 BMJ study followed over 8,000 seniors for 6 years. It found that those who used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease, and for longer-acting drugs like Valium, the risk was even higher. Common side effects include feeling dull or disconnected, struggling with short-term memory, trouble learning new things. The worst part? When seniors try to stop, withdrawal symptoms like severe anxiety and insomnia make it feel impossible, creating a trap. What can you do? Never stop a benzodiazepine suddenly. Always taper under a doctor's supervision. Safer alternatives include buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy for anxiety and insomnia. Number 4. Amitriptyline, Elavil. At number 4 is amitriptyline, sold under the brand name Elavil. It's an older antidepressant that is still prescribed today, not just for depression, but also for chronic pain, migraines, and insomnia. It might look like a multi-use pill, but here's the shocking truth. Amitriptyline is one of the strongest anticholinergic drugs still in circulation. That means it blocks acetylcholine, the very chemical your brain depends on for communication and memory. A large 2015 JAMA internal medicine study followed more than 3,400 seniors. It found that those who took higher cumulative doses of drugs like amitriptyline had a 54% greater chance of developing dementia. And here's the scary part. You don't need a high dose to see effects. Even low nightly doses, taken for years, can slowly chip away at memory. Many seniors describe short-term memory problems, word-finding difficulties, constant mental fog. What can you do instead? For nerve pain, duloxetine or gabapentin are often safer alternatives. For sleep, melatonin or low-dose doxepin, which has far weaker anticholinergic effects. For depression, newer antidepressants like sertraline, Zoloft, or escitalopram, Lexapro, are generally considered much safer for seniors. Number 3, paroxetine, Paxil. At number 3, we have paroxetine, sold under the brand name Paxil. It's a type of antidepressant called an SSRI, selective serotonin reuptake inhibitor. Millions of people are prescribed it for depression and anxiety. And at first glance, it looks like any other antidepressant, similar to drugs like Lexapro or Zoloft. But here's the dangerous twist. Paroxetine is the only SSRI that also has strong anticholinergic effects. That means it doesn't just adjust serotonin levels, it also blocks acetylcholine, the memory chemical your brain desperately needs, especially as you age. In a 2021 review published in Frontiers in Psychiatry, elderly patients taking paroxetine showed measurable declines in short-term memory, verbal recall, and attention span within just 12 months. The study also found that seniors on Paxil were 30% more likely to develop early cognitive impairment compared to those on other antidepressants. The cruel irony. It's often prescribed to stabilize mood, but instead it undermines memory and mental clarity. What are the safer options? For seniors, antidepressants like citalopram, Celexa, or escitalopram, Lexapro, are considered much safer. Supporting brain health with B vitamins, especially B12 and B6, can also make a real difference in mood and cognition. So if you or a loved one is on Paxil, it's important to ask the doctor about switching to alternatives. Number 2, antipsychotics, Seroquel, Risperdal, Zyprexa. At number 2, we come to one of the most alarming categories, antipsychotics. These include drugs like quetiapine, Seroquel, risperidone, Risperdal, olanzapine, Zyprexa. Originally, these were developed for severe mental illnesses like schizophrenia and bipolar disorder. But today, they are often prescribed off-label to seniors for things like sleep problems, agitation, or behavioral changes in dementia itself. Here's the tragedy. Many seniors don't even realize they're taking an antipsychotic. In a 2022 study published in the Lancet Healthy Longevity, researchers followed more than 25,000 older adults. They found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to suffer worsening cognitive decline within just 12 months, even if they had no prior dementia. And the dangers don't stop there. These drugs also increase the risk of strokes, sudden death, severe sedation leading to falls and hospitalizations. How do they cause so much damage? Antipsychotics suppress dopamine, a chemical critical for mood, motivation, and memory. When dopamine crashes, the brain becomes sluggish, unresponsive, and disconnected. Family members often describe their loved one on these drugs as dull, emotionally flat, or zombified. What's the safer path? Ask the doctor why the medication was prescribed and if it's truly necessary. Non-drug approaches, like creating a structured daily routine, reducing noise, improving lighting, or addressing hidden pain, often work better. If a drug is absolutely necessary, the lowest dose for the shortest possible time should be the goal. Remember, these are powerful psychiatric drugs, and they should never be handed out casually. Number 1. Anticholinergic polypharmacy. And now we've reached number 1. The most dangerous threat to a senior's memory isn't a single pill. It's the combination of multiple medications with anticholinergic effects. This hidden danger is called anticholinergic polypharmacy. Imagine this. A senior takes Benadryl at night for sleep, oxybutynin for bladder control, and amitriptyline for nerve pain. Each of these alone can cause memory problems. But when taken together, the effects don't just add up, they multiply. The brain becomes overloaded. Acetylcholine is blocked from every angle, and the result is rapid, drug-induced dementia. A 2022 study in Age and Aging tracked over 280,000 older adults. It found that those with the highest anticholinergic burden had a 120% increased risk of dementia within 10 years. That's more than double the risk. And here's the hopeful part. This type of dementia is often reversible. When the drug burden is reduced, when unnecessary medications are tapered off and replaced with safer alternatives, many seniors experience improved memory, clearer thinking, and even regained independence within weeks or months. What should you do? Request a medication review with your doctor or pharmacist. Go through every prescription, over-the-counter drug, and supplement. Ask specifically, does this drug have anticholinergic effects? Use online tools or professional software to calculate the cumulative anticholinergic burden. The truth is, many seniors don't need half the medications they're on. By reducing the load, you can protect and, in some cases, restore precious brain power. So, there you have it. The 9 most dangerous medications that can silently accelerate memory loss and dementia. Diphenhydramine, Benadryl. Proton pump inhibitors, Prilosec, Nexium. Oxybutynin, Ditropan. Statins, Zocor, Lipitor. Benzodiazepines, Xanax, Valium, Ativan. Amitriptyline, Elavil. Paroxetine, Paxil. Antipsychotics, Seroquel, Risperdal, Zyprexa. And finally, polypharmacy, the silent killer. Now, we want to hear from you. Which of these medications are you currently taking? Have you noticed brain fog, forgetfulness, or personality changes since starting a new drug? Are you willing to ask your doctor about reviewing your medications this week? Share your experiences in the comments. We read every single one, and if you found this video valuable, don't keep it to yourself. Subscribe to Senior Guide right now. We bring you the latest science-backed insights to help seniors live healthier, sharper, and longer lives. Your brain is resilient. With the right knowledge, you can protect it and even reverse damage. Thanks for watching Senior Guide. Until next time, stay sharp and stay strong.